Do you know the difference between a pap smear and a pelvic exam? They might seem like they're one and the same, but they're actually two different things. Let's start with a pap smear. A pap smear is specifically a collection of cells that comes from the surface of the cervix. The cells are then placed in a container and sent to a pathologist. The pathologist looks at the cells and determines, do they look like normal cells, or do they look like they might be leaning toward a precancer or a cancerous type of cell? That's all that a pap smear is. It's just the collection of cells from the cervix. Now, a pelvic exam, on the other hand, as you can imagine by the name, is an examination of the pelvis. This is when the clinician will look at the external genitalia, the vagina, and the internal organs using either a speculum or their hands. The pelvic exam does not necessarily include a pap smear. Now, if you've had a pap smear, you've definitely had a pelvic exam because we need to use a speculum to make sure we're seeing the cervix and taking that specimen specifically from the right spot. A pelvic exam may not have a pap smear done. You may have other tests like cultures or other different types of tests we use for different situations, but it does not always entail a pap smear. Hope this clears up what those two are to help you determine what you've had in the past so you know what you need in the future.